A scar is with you forever. A mark will go away on its own after 6 to 9 months. So this is a scar and those are forever, so you need to do treatment for it. The acne scars, when you see it with light shining directly, they are not so prominent, but when a light is shining tangentially, that means from an angle, then the scars are visible. So there are 2-3 types of scars and they require different treatments. So I want y'all to do, if any of y'all have scars, I want you to stretch your skin between your index finger and the thumb. And if the skin is stretched and the acne scars disappear, that is the box scar or the rolling scars. That means with treatment, you will get great results. Then there's another type called the ice pick scars. It's like somebody has taken an ice pick and has poked your skin. So those scars are a little more difficult to treat, but nonetheless, we do have treatments for it. Then there are some scars, what we call as hypertrophic scars or keloids. Those are commonly seen on the jawline, on the chest, on the back, and on the shoulders. So those are scars which are raised. So when they are raised, that will be a different treatment. Now let me come to the treatments. Now the principle in these scars is that there is a dent which is left behind. The principle is we have to make collagen grow. So there is a hollow here. So we stimulate the collagen over here to grow, so that this is now a cross section which I am showing you, so that when the collagen grows, it pushes the skin up in one session, second session, and third session. Hopefully, fourth session you get this. This is the end result which we want, which we all want. So the principle is to grow the collagen, to stimulate the collagen. Retinoid creams, which I told you, which you will be applying at home, they cause collagen stimulation, rapid turnover of the skin cells, but this will take minimum 2 to 3 years. So now we want something very quick, we are in the 21st century, so we want something very quick. So now quick would be treatments, of course, in the doctor's clinic, in the dermatologist clinic, we can start first with chemical peels. Now chemical peels, we have retinol containing peels, that is, we call them yellow peels or TCA peels. Now these peels go a little deeper. Remember, we have to go to the dermis, we have to go to the collagen. When these peels are applied, you go home with the peel, and for the next 5 to 6 days you'll get scaling of the skin, you'll get a little peeling, and the precaution you have to take is that no other creams are to be applied, and you have to apply a sunscreen because your skin can get sensitive. Your skin is peeling, it's scaling, so you have to take care of the sun. A sunscreen has to be applied. So this is for chemical peeling. Then of course we do have what we call as microneedling. Microneedling is, that means with a derma roller, a roller which has 540 needles, the needles go in, stimulate your collagen, and a lot of products which stimulate your collagen are also put. This can be done with a derma roller, can be done with a derma pen, and now we have microneedling machines. So this can be done with the microneedling machines. This has to be done in the clinic. Derma roller can be done once a week, but the microneedling machines can be done once a month, and the depth of the needle is about 1 to 1.5 millimeters. It goes below the skin. So this is the microneedling. Then of course we have lasers. Now we have lasers. These are fractional lasers. The fractional lasers cause pinpoint like needles. The beam of light goes down, again stimulates your collagen for it to grow. But the difference between microneedling and laser is that in microneedling you can get a little oozing, you can get a little bleeding and a little raw surface, but in the lasers you'll only get scabs the next day right away. And again, there is what we call as a downtime of about 5 to 6 days. The doctor will tell you about the downtime of each. So post laser, about 5 to 6 days, you can wear makeup and go to office. You don't have to stay indoors. So this is about the fractional CO2 lasers which we have, and there are other lasers, non-ablative lasers, which don't cause marks, but of course they are not as effective. Then next we have PRP. All of y'all have heard about this, that is platelet rich plasma. So that solution is almost like liquid gold. It has growth factors, and those growth factors are injected by itself. It's your own blood which is taken. Platelets are isolated and the growth factors are extracted from the platelets, and these growth factors are injected under your skin, or they can be combined with microneedling or with the fractional CO2. So this is combined, and that is additional improving your collagen regrowth. So this is PRP. Then there is one I would like to mention over here, subcision. What is subcision? A needle is put in under your skin, and whenever there is a scar, remember there is a fibrous band which is tethering your skin below. So it is pulling your scar, the base of the scar below. So subcision, what it does is the needle will break that tether. It'll break it, and once that is done, we can inject PRP into it, and that also gives great results. Now, once somebody will tell me, Doc, I have a wedding 1 month later, I don't have time. Okay, we have the solution. As I said, this is the 21st century. So what we do is that we can put a cannula. The cannula will remove the blocks, the fibrous bands, and at the same time, either we inject the PRP, but of course that will take time, or we inject dermal fillers. Dermal fillers are hyaluronic acid fillers, and they are temporary. They last for about a year, 8 months to a year, and with that we can fill in the filler wherever the gaps are. So this will give you instant results in 2-3 days. And here I'd like to mention one new kid on the block is that NanoFat. NanoFat treatment, this is the latest thing. So the fat from the abdomen is removed by a lipocannula, and that is broken down into nanofat, into nanoparticles, and that your own fat is injected under the scars. So remember what I said, 2 things at one time. So you become slimmer and your face gets smoother. So this is the latest, that is NanoFat treatment for the scars. And remember I told you about ice pick scars. Ice pick scars, they are literally like as if a needle has gone in. Now that treatment for that scar, all the others what I mentioned may not work. We have to take a toothpick, and we have a chemical called TCA, that is trichloroacetic acid, and that is poked right in that ice pick scar so that it causes a little trauma, and that makes your collagen grow. So this is the treatment for the ice pick scars. And I also talked to you about scars which are a little above the skin, that is the hypertrophic scars or keloids. For that also we have treatments. These other treatments would not work for it. There are some lasers which can, but we inject in these hypertrophic scars, we inject intralesional corticosteroids. This will help to flatten that hypertrophic scar, and this is done once a month, maybe 3 sessions. Thank you.